Hi, my name is Denise Wong, and I'm a board-certified facial plastic surgeon at the San Francisco office at Wave Plastic Surgery. Today I'm going to talk about Asian upper blepharoplasty, specifically the advanced suture technique. So Asian upper blepharoplasty is one of the most common surgeries performed in the Asian population. Some patients do not have an existing double eyelid crease, and what that refers to is the crease that forms along the upper eyelid that accentuates the eyes, makes them appear bigger and brighter. There are two main methods used to create the double eyelid crease. The first is the full incision technique, and the second is the suture technique. The suture technique is one of the main methods used to create the double eyelid crease. The Wave Advanced Suture technique incorporates new innovative methods, including some techniques that I learned while I was in Korea. Through tiny punctures made along the upper eyelid crease, I use microplastic surgical techniques to place a very fine suture within the eyelid crease, and that's anchored to the tarsus, which is a firm structure within the eyelid. This is done in multiple points in a continuous fashion, and this secures the upper eyelid crease. When choosing the best surgical method, it's important to look at how much skin they have, how much fat, if the patient has ptosis or heaviness of the eyelid, as well as individual preferences. And I think that even among the Asian population within the Asian ethnicities, whether you're Chinese, Japanese, Korean, Vietnamese, Filipino, Thai, everybody has a different eye shape. And it's important to understand those individual characteristics to make sure that the eyelid design is tailored to the individual as well as matches the entire face. So the recovery for the suture technique is fairly quick because no skin or tissue is removed. So most patients have swelling that lasts in general 3 to 5 days, and the majority of swelling is resolved within a week. The results are seen immediately. Once the surgery is performed, the double eyelid crease is visible, and you may have a little bit of swelling, but you definitely will see results right away. So because no skin or tissue is removed, the risk of scarring is minimal. You don't have to make a full incision, so you don't have the scar from making the full cut. The procedure typically takes about 1 hour, and it's performed under a local anesthesia as well as IV sedation. So patients are very comfortable during the procedure. Patients can typically go back to work after most of the swelling resolves, so the recovery time is very, very fast. In general, I feel that the Asian upper blepharoplasty is a very technical and very precise surgery. It requires a lot of experience, and at Wave Plastic Surgery, we have a lot of experience with the Asian population, Asian patients, so we're very familiar with the unique anatomy of the Asian eyelid, which is extremely important. That being said, I think having that knowledge allows us to perform the surgery in a very meticulous fashion and provide the best results possible.